So I will tell you about my experiences about tDCS, how I have been doing it in my private practice. And in this presentation, I will concentrate on, I will give you some thoughts about depression and its treatment globally and also in Finland. And also I will introduce you some basics of tDCS in treating depression. And also I speak a few words about maintaining remission. And I have also some of my patient cases I would like to introduce to you. And I have around 45 minutes of presentation, and then you are free to ask questions, and I try to answer them. And feel free to ask your own language, and then I try to understand, and then maybe I can get some translation help also, and you can write your questions. But this is my I work in Tampere University. I teach at medical school, and also I'm a specialist in psychiatry in Tampere University Hospital. But actually this tDCS work I mainly do in my private practice, which I have 3 of them. And because in Finland we really, it's not very widely used in Tampere University Hospital, because I think that in specialized psychiatric care, maybe the patients are kind of too ill or too severely depressed. So I think that this treatment method may be early in the depression treatment. But these are my places that I work, or my work projects. And then I would a bit introduce you about Finland. We live kind of near Russian, but we are independent also, of course, and we are kind of sparsely inhabited. We have around 5.4 million inhabitants, and our specialized psychiatric care, it's divided in our hospital district, which we have 21, and each catchment area has 1 or more psychiatric units, and there in the psychiatric specialized care, the neuromodulation is given. And we have around 30 neuromodulation units in Finland right now. And also this tDCS is used in the private practices, like I was telling about. And actually, I a little bit go further to depression globally, because if we have around 300 million people worldwide suffering from depression, and in Finland we have around 300,000 people, prevalence is 5.6, and I just took also Switzerland here, and you are a little bit lower in prevalence than Finland, but you have also cases around 400,000. So I think that we are kind of having a big problem globally with depression, so that we have to kind of be efficient when we treat our patients, and also that the treatment it's enough to all our depression patients. And in Finland, we have these national current care guidelines. I think that you in Switzerland may have some guidelines also, and actually worldwide there are quite many different guidelines to treat mental illnesses. But our guidelines, they are independent, they are national, and they are also patients can see these guidelines, and they are done like to support the healthcare decision making, and also improve the quality of care, and decrease the inconsistencies between treatment practices. And they are very important to our doctors and also specialists, that we follow these guidelines, and also we know that which treatment methods are efficient and which should be avoided. And in Finland, we treat depression basically in primary care or in occupational healthcare also in students' healthcare and in private practices. And if the depression is complicated, so our guidelines guide that then the patient should be guided to specialized psychiatric care. And in case the primary care doctor gives the patient medication and then he's not responding, the first one, so then the guidelines guide that you should try another medication and also combine psychotherapy. And if the second medication trial is failing, so then the patient should be guided to a specialized psychiatric care. But in Finland, we have quite huge lack of psychiatrists at the moment, and our patients with complicated or treatment-resistant depression, they may not have the specialized psychiatric care soon enough when they need it. So most of our depressive patients, they are on waiting lists. They are too long there, and this predisposes to chronicity and treatment resistance, and also difficult to treat depression. So that's why we have to enhance the depression treatment at first line when in the primary care and occupational health care, and also in students' healthcare. So what